Hi, good afternoon, everybody. Thank you for being here at the wonderful Love Your Heart Expo. Thank you, Adventist HealthCare, for organizing this. A little bit about myself before I start talking about my topic for the day. I'm Geetha Pinto. I'm a board-certified cardiologist and on staff at Washington Adventist Hospital and Shady Grove Adventist Hospital. I also work as a private cardiologist for Cardiac Associates, which has its offices in Rockville and Germantown, Maryland. A little bit about my training. I did my med school at the University of Texas in San Antonio and then moved up to New York City, where I did my internship and residency at Columbia University, and then came back down to the Washington, D.C. area, where I did my cardiovascular training at Georgetown and Washington Hospital Center, and now I'm on staff at the Adventist Health Group. So a little bit about my talk today. I'm going to be talking about a very special topic, very dear to my heart, and that's about women and heart disease. So I'd like you all to sort of try and keep your questions to the end. I'm going to give you a little presentation about it, and then I'll be happy to answer any questions that you have about heart disease in general and specifically women and heart disease. So a few facts about women and heart disease. More women die of heart disease than strokes, lung cancer, and breast cancer. In fact, for every woman with breast cancer, there are 4 women that die from heart disease, and yet there's not enough press in the world to make us aware that we as women are more at risk for dying from heart disease than we are from breast cancer. And so we as women need to be better educated and also participate more in taking care of our heart health. What's also important to know that in the recent years, there have been great advances in technology and healthcare to save a lot of lives from heart disease, but the unfortunate truth is that more women now die of heart disease than men. We always thought of heart disease as the disease of men, but the truth is we as women now supersede men with heart disease and dying from heart disease complications. And therefore, it's very important for us to know more about heart disease. A few other facts that are sort of astonishing. Women always take the role of caretakers. And what's interesting to know is that studies have shown that about 79% of women would call 911 if someone else near them was experiencing symptoms of a heart attack, but only 53% of women would do the same for themselves. So that's a shocking fact. And what's more important to know is that 46% of women would do something else other than call 911. They would either take an aspirin or try to drive themselves to the hospital if they were having a heart attack or having the signs of having a heart attack. It's important to know that if you are experiencing signs and symptoms of a heart attack, please call 911. It's the best thing you can do for you and your loved ones is to take care of yourself and let us take care of you immediately. There's a very important saying in medicine. It's time is muscle. The longer it takes for the artery to be opened up and for the muscle to get its blood supply back, the worse your heart recovery will be. And so we cannot waste time. If you experience symptoms of a heart attack, you need to call 911 immediately so we can save every bit of muscle that you have. So that brings me to the next point. What are the symptoms of a heart attack? Well, both men and women have common symptoms of a heart attack that we all see in the movies and on TV. It's chest tightness or a pressure-like sensation or a heaviness in the chest area. And men and women experience these symptoms. However, women are also very likely to experience symptoms that are not necessarily traditionally thought as heart disease. For instance, feeling a sensation of shortness of breath or discomfort in locations and areas in your body that you don't associate with the heart, like in between your shoulders or in your upper arms or up in your jaw. These may be your signs of having a heart attack. You may also be more fatigued than usual or you may feel like you have a cough or a cold or short of breath for no reason. These are symptoms that women usually have associated along with the traditional I have chest pressure and tightness in my chest that we all know and think about as having a heart attack. What's important to know for us as women is that just by the nature of our gender, we're at increased risk for having heart disease when we have diabetes or we have high blood pressure during pregnancy. So if you experienced high blood pressure during pregnancy, or if you experienced gestational diabetes, then you're at increased risk of developing heart disease in the future, even if you have completely recovered from diabetes and high blood pressure after pregnancy. And young women need to know that if they have polycystic ovarian syndrome, or PCOS as it's generally known as, it's associated with having a much higher risk of developing heart disease and having a heart attack. And that's especially because with PCOS or polycystic ovarian syndrome, these people have obesity, high blood pressure, high cholesterol, and they're at a high risk of developing diabetes later on. So that's a word out to all of our young women. Please get screened for PCOS, and if you have it, try to make changes immediately. So my next topic will be, so then how do we deal with improving and preventing heart disease in women? Well, there's 3 ways. 1, know your numbers. 2, know your risk factors. And 3, know what you can do about these risk factors to decrease your risk of developing heart disease. Number 1, know your heart risk factors. There's a wonderful expo right here where they can show you and tell you about your cholesterol, your weight, your BMI. You need to know these numbers in order to be better equipped to take care of yourself. Know what your cholesterol is. Know what your fasting blood sugar is. Know what your blood pressure is. If you know this, you will be better able to take care of yourself and understand your health. And let's talk about the risk factors that put us, both women and men, at risk for heart disease. There's 2 types of risk factors that you can change or modify, and risk factors that you cannot modify. Talking about the risk factors that you cannot modify, age, as you grow older, you're at a higher risk of developing heart disease. Women after menopause tend to have much higher rates of heart disease than women before menopause. If you have a family history of heart disease, you can have an increased risk of developing heart disease. And sometimes some people have family or genetic reasons of having high blood pressure, diabetes, and cholesterol. It's a risk they cannot help. And these are the things we cannot change. Sometimes gender and ethnicity put you at increased risk for having heart disease. Women who are African American, Latina, or Native American are at a higher risk of developing heart disease than others. So this is important information. You cannot change your race and ethnicity, but you can be empowered by knowing what your risks are. And then let me get to the modifiable risk factors. These are the ones we all love to know and maybe don't like to work on as much. But the most important one is quit smoking. Every cigarette you smoke takes away 5 minutes of your life. A person who smokes lives 20 to 30 years less than a person who doesn't smoke. So the data is out there. The second is your cholesterol. Your total cholesterol should be no more than 200. So keep a check on your cholesterol. At the age of 20, everybody should have their cholesterol checked at least once. And then depending on your risk factors, you need to have it checked every few years, and your doctor will be able to advise you better on how often you need to check your your cholesterol. The third is know your blood pressure and try to reduce your blood pressure. Your systolic blood pressure, and today they have people out there at the expo doing blood pressure checks. Your systolic should be no more than 120, and your diastolic, which is the lower number, should be no more than 80. If on two separate readings, these numbers are higher than 120 over 80, you have high blood pressure, and you need to take control and get help with it. The other modifiable risk factors are diabetes. You know, weight is a big problem in the United States, and weight goes in hand with developing diabetes, high blood pressure, and high cholesterol. So know what your diabetic risk is. If you're obese, try to lose weight. Your risk of diabetes comes down. If you're overweight, try to lose weight. And even if you're normal weight, try to exercise and do your best to decrease your risk of developing heart disease. And finally, some of the modifiable risk factors include depression and stress. Yes, it's not a phantom, it's true. If you are depressed and if you have stress in your life, it puts you at an increased risk of developing heart attacks and heart disease. In fact, if you may have heard at football games and at soccer games in Europe during the World Cup, lots of people come in with heart attacks. It's stress. Stress does a big deal of damage to your heart and to the arteries of your heart. So if you can reduce even the slightest bit of stress in your life, then it will help you a long way. And finally, I'd like to talk to you about how you can decrease your risk of heart disease. Stop smoking. Like I said, every cigarette takes away 5 minutes of your life. And the good news about smoking and heart disease is you quit smoking today and your risk of heart disease decreases today, not 10 years down the lane, but today. And what's even better is in 5 years, your risk of having heart disease from smoking becomes close to you having never smoked. So that's the good news about smoking and heart disease. It's not true for lung cancer, but it's certainly true for heart disease. You can decrease your risk to 0 when it comes to smoking and heart disease. And then exercise, at least try to do a little bit of aerobic cardiovascular exercise. Start with 10 minutes a day. Just 10 minutes, jumping jacks, whatever it is, do it for 10 minutes a day. It will help you tremendously. It'll also help you with stress and depression, because when you exercise, your body releases endorphins, which are actually natural antidepressants and natural stress relievers. So you're doing good for your body in more than just one way. And finally, I'd like to say is limit your salt intake, because it can increase your risk of having high blood pressure. The 3 major things that increase high blood pressure or increase blood pressure are salt intake, alcohol intake, and obesity. And all of these are related to having increased heart disease. So I'd like to end on that note. Thank you again, Adventist HealthCare, for organizing this wonderful expo and doing such a wonderful service to the community here at, in Montgomery County. Thank you again for listening. And I'll take questions now. There's people, yeah.
My husband here has 12 stents. Quite a few was put in at Adventist Tacoma Park. And we do pretty much all the stuff you talk about, but yet his pressure is still high and low. You know, he's diabetic. Okay. Of course, heart disease that it runs in his family. So what in addition we doing that we could do to help?
Okay. So there are a lot of people that actually come to me and say, look, I've done everything I possibly can, and I still have heart disease. What do I do about this? And I'd like to tell them that, yes, genetics plays a big role in how your body reacts to certain materials and how you develop heart disease. But what you've already done has given you so much better health than you would have had without doing this. So, for instance, if you didn't diet or exercise, you could have had a heart attack at the age of 30, but because you did everything you possibly could, you delayed it further, and you're in better health and physical condition to bear the stress of heart disease. So though it may be disappointing to some people to say, look, I do everything I can, I still cannot, stop having heart disease. The good news to them is their body is still healthy, and there's still ways we can help them, and you have only prevented yourself from having heart disease earlier. He would have been... Yes. Yeah. That's proud of you. If you guys just want to hear, the lady in front said that he was told that if he didn't do everything that he did, he would have passed away much earlier. But now he's here and alive in front of you because he's been doing everything that he can possibly to decrease his risk.
If a person stops smoking years ago, but they still chew Nicorette gum, even though it's not that much, is this the same as smoking?
No, the supplementation of nicotine actually is not the problem. The problem is everything else that comes with the cigarettes in it, okay? There are other carcinogens that actually are a problem more than just nicotine. And that's why chewing Nicorette gum is okay. All right, do we have any more questions?
Yes, doctor, I had triple bypass 2 years ago, yesterday to be exact. But after my triple bypass, I had to have 3 stents put in. Why was that?
Well, coronary artery disease is a disease of a lifetime. So the first time someone really develops heart disease or coronary artery disease, or what we call atherosclerosis, actually happens in the teenage years. So there's a little bit of plaque or blockage that starts forming. And over time, it builds up, okay? So people can have, it's a progressive disease. It happens over years of time. So even if you've had a bypass, you still have arteries that are still there in your heart that can continue to create blockages. And that's why you probably had a bypass, but your arteries continue, a triple bypass, and your arteries continue to develop blockages. And that's why, in order to relieve those blockages and in order to restore blood flow to the suffering heart muscle, you got stents. 3 stents.
I'd like to know where atrial fibrillation fits in this.
I'm sorry, I think that mic may not be on.
She's asking, she would like to know where atrial fibrillation fits into this.
Actually, we have a wonderful expert who will be talking about atrial fibrillation in about an hour, Dr. Sean Baynard. And with heart disease, atrial fibrillation, when I'm talking about heart disease, I'm specifically talking about developing blockages in different arteries of the heart, something called atherosclerosis. Atrial fibrillation is a separate heart rhythm problem, and it's not associated with increased heart disease, although some people with heart disease or blockages in their heart can develop atrial fibrillation as a result.
Hold on, we'll get you.
Has any progress been made over the past year with regard to growing arteries from stem cells?
Yes, there has been a lot of research that has been done with regeneration of heart muscle from stem cells. As you may or may not know, the heart muscle does not regenerate itself like the liver muscle. So once the heart muscle dies, it cannot be revived again. You cannot form more heart muscles. But there are new studies that are showing that if you can inject stem cells in your circulation, they can go to the heart and generate more muscle. We are very far away from actually using this in clinical practice. So yes, there is a lot of research out there. There are lots of big universities pouring lots of money into developing and regeneration heart muscle from stem cells, but we're nowhere close to using it in clinical practice.
What about new arteries or veins?
Actually, the problem is not the artery or the vein, but it's more the muscle. So people are more focused on developing more muscle than the arteries and veins. I am not aware of any research that generates or creates arteries themselves, no.
I would like to ask you, I was diagnosed about 2 years ago with an MVP, and I know that's a problem with the valve, but I don't know exactly what it is, and I would like
You're talking about mitral valve prolapse. It's separate from heart disease or atherosclerotic disease in women that I'm talking about. It's a solely valvular problem, not to do with anything in terms of atherosclerosis, and I can talk to you a little bit about it after the talk.
You said that atherosclerosis was progressive. You can't do anything about it to stop it?
You can slow it down, and some people are genetically more prone to developing atherosclerosis than others. I just went over a list of things that you can do. If you exercise, if you don't smoke, eat healthy, those are the very few basic things you can do to slow down the rate of atherosclerosis.
Okay. And when you do a bypass and you take a vein from the leg, right? Does that grow back in the vein in the leg?
So there are certain veins in our body we don't necessarily need. Veins are just conduits increasing blood flow back to the heart. And when that vein is taken from the leg, there's just different channels that form that replace that vein. So it's not necessary to have that vein in your leg, and it is bypassed to the heart, where it acts like an artery to supply blood to the area of the heart or the artery that is blocked with atherosclerosis. All right, thank you very much, everybody, for being here. One last question.
Can you hear me?
Yes.
Okay, so a lot of people here today have been getting their cholesterol checked. Can you just talk for a minute or two about what the numbers mean? You know, what is LDL, HDL, the total number, etc.?
Sure, absolutely. So total cholesterol is a count of all the cholesterol in a little area, deciliter of your blood. That's the total cholesterol. Now, there's different types of cholesterol. You may have heard good cholesterol and bad cholesterol. LDL traditionally is a bad cholesterol. Why is it bad? Because this cholesterol, when it circulates in the body, it can injure the blood vessels and it can collect in the arteries, and that is the predominant basis of formation of a plaque or a blockage, the atherosclerosis we talked about. That's why it's bad, because it forms plaques in different parts of the body. If it forms plaques in the brain, it can cause a stroke. In the legs, it can cause something called PAD. But if it forms plaques in the heart, it can cause heart attacks. The other part of cholesterol we talk about is good cholesterol, or HDL. The role of good cholesterol is to essentially take the LDL from everywhere and bring it back to the liver so that it can be broken down. And that's why it's good, because it's taking away all the bad cholesterol from the blood and bringing it back to the liver where it can be broken down again. And that's why the higher your good cholesterol, the less atherosclerosis or blockages you will develop. So that is the basis of cholesterol. All right, thank you very much again for having me here.